Hi everyone, today I'm going to be responding to the people who submitted questions for a second opinion, and I'm also going to be responding to some other YouTube comments that people gave that are a little bit more complicated and required a longer explanation. This is Dr. Tamisha Denis, and this is The Modern Smile. Everyone, I am in my car. Now today I'm dressed down a little bit. I'm wearing my Modern Smile t-shirt, and I'm also wearing a baseball cap. And I worked out earlier today, and I decided as I'm waiting for my daughter's violin lessons that this would be a great time for me to answer some of the YouTube questions that I got and some of the people who submitted x-rays and comments and also submitted questions for me to answer. So here goes. Me. Now, this first question about implants is not a very consumer-friendly question. This question is one that's probably going to be a little bit more debated by dentists, and is going to vary a lot according to the dentist that you see and the opinion that you get. So first of all, I'm going to say the facts and kind of the ones that are subject to interpretation. The first thing is any implant that is done further in the back of the mouth, and of course I didn't get all the details of this question, but any implant that's done further back in the mouth is going to be a more difficult implant. And I'm going to tell you the two reasons that is, to keep it simple. On the top, right in this area, is your sinus. We call that the maxillary sinus. Now there are different sinuses, nasal sinus, paranasal sinuses, but for the context of teeth, the maxillary sinus, it sits right up in here, and it does this kind of like upside, this U shape that comes down. Now when you have teeth, some teeth may sit inside of the sinus. So as you go further back into your mouth, the probability that the sinus is closer will be higher. So once we get to about the molars, especially the first molar, we get closer to the sinus. Some molars actually sit in the sinus, the tips of them, and some of them are close. When you have an implant done in the last area of the mouth, we are closer to the sinus, meaning that we have less bone in order to place an implant. Now, for the sake of describing what we analyze when we talk about bone, when it comes to implant, we're not only talking about the width. Sometimes dentists like to use the word platform, but we also like to talk about the height of bone. So how much width we have and height. So when you go further back there, you might have shorter height and less space for you to place an implant in there. When we talk about the bottom, we're not concerned with sinuses at all. Now we're concerned with a nerve. It's called the inferior alveolar nerve that starts right about your ear and runs down to about halfway in your face. Now that nerve also, because there is a channel in which that sits in, may sit a little higher, may sit a little lower, and that may inhibit how much space you have in order to place an implant. So when you get the further back, of course, naturally going up, you're going to get closer and closer to the nerve. Now, because of that, those pose a little bit more finesse, I like that word, finesse, when it comes to whether or not you can have an implant placed all the way in the back. Yes, they're a little bit more tricky, but they can be done. Now, with the limited information I have about your case and no x-rays, I can say that yes, that is true. However, with CT scans, 3D x-rays, if you see some of my other videos of me talking about why we use 3D x-rays when we do implants, we can know some of those things about the sinuses and about those nerves in advance to keep your implants safe. Now, the second question, which I'm breaking down your question, the second question about whether or not mini implants or micro implants is a good idea, I will tell you reluctantly, I don't think that's a great idea. Now, micro implants were invented in order to retain dentures in people that don't have that much bone. So a lot of times you will see mini implants placed in the front and the denture will clip onto that. I also have a video talking about mini dental implants versus traditional implants when it comes to holding up a denture. So absolutely, that is true. However, when it comes to a molar area to hold up a single tooth, I do not believe a mini dental implant or a micro dental implant is that great of an idea to be able to hold up a molar that's going to do a lot of chewing, because that molar is going to take a lot of force and it is not going to be able to hold up with the force of your bite in the back of your mouth. So that's my opinion on the topic. I don't see any reason why you can't have a traditional implant. An implant is a great investment because if you're as young as I think you might be, well, even people in their 70s, implants are a lifetime restoration and they are worth the investment, because as you get older, if you continue to lose teeth without replacing them, you will sure enough end up in a denture or partial, which is not a great lifestyle. I hope that helped to kind of clear some things up so that you can understand better why we not only think that placing implants towards the back is a little bit more tricky, but also why micro implants may not be the greatest idea. Hi, Dr. Dennis. I had different dentists look at these. The first one I went to said I had a number of watch areas, but nothing was needed to be done. The next one I saw said that these areas were actually cavities and needed to be filled. The same dentist also said she had a few areas she wanted to watch after poking my teeth with her pick. What do you think? And what is a watch? Thanks, Gabe. Now, this second question that I have about whether or not dentists like to watch or fill, that's the way I'm going to interpret it, is so subjective. Dentists are as different as people are, personalities are. It is so different, our opinions, and they will always vary depending on the personal dentist's opinion as well as philosophy. I have a very flexible approach to this. Now, unfortunately, according to these x-rays, I do not see anything wrong with your teeth, but the reason I don't is because x-rays traditionally only show when bigger things are going on. If we have small cavities that are within that range of should I watch it or should I fill it, that is going to be better seen by a photograph or a clinical exam in which the dentist is looking inside of your mouth. Now, this is how I do take it with my patients. If I have a patient and they have a very, very small cavity that is still in enamel, meaning it hasn't gone into the second layer of teeth, which is what we call dentin, which officially makes it a cavity. So when you have a cavity that has entered the dentin, that is officially a cavity. When it is in enamel, not quite yet. So if I have a patient comes in, they have a small cavity in the enamel, I personally look around their mouth if I don't know them already. And if their whole mouth is filled with all kinds of restorations, in my opinion, we're going to fill that. If I have a patient that has a tiny thing like that and they've never had a filling before and they hardly have anything to see, I may watch that. And the reason that I do that is because We also have something in dentistry called caries risk. So someone who's getting cavities and they get big fast has a higher risk for decay becoming a root canal or something major than someone has a small cavity, and that small cavity stays there like that for years and years to come, and they never quite need anything. Now, that caries risk may be according to lifestyle, the things that you eat and drink. It may be according to genetics. What did your mom or your dad give you to make you more prone to cavities? It may be because of the structure of your teeth, your salivary flow. There's a lot of different factors that make somebody more higher risk to cavities and not. So in my opinion, if you've already had a lot of restorations that got big and you needed to take care of them, I would take no chances and get that filled. If you feel like you have hardly ever had a cavity and your dentist thinks it's okay to watch, then I would watch. That is why I'm a little different, because I want to see your current circumstances and how it applies to you individualized. I do not have a cookie cutter, one size fits all circumstance for all people, because I like to talk to you. I like to get history. I want to know what else was going on before this day. So I hope that helped answer that question, to watch or not to watch. Hi, the person from the Caribbean here. I recently took out tooth number 2, but tooth number 1, it seems like it's out of place, and tooth number 3 seems to have a crack or chip. I was thinking to have tooth number 1 extracted, but it hurts on and off, but it's improving day by day. So what is the best solution to my problem? Please help. The third question that I got, to me, I feel like the person already has the answer. If you have a tooth that's causing you a lot of pain, there is no reason that you shouldn't be jumping to the dentist to get that tooth out, especially if it's a wisdom teeth. As far as we look at it in dentistry, wisdom teeth are like your appendix. You don't need it. You can live without it, and there is no reason for you to live in pain over a wisdom tooth. So if you have a wisdom tooth that is hurting you that bad, you need to get in there and take care of that wisdom tooth ASAP. Take it out. I would go one step further and say, if you have other wisdom teeth that even have the slightest of cavities, take them out. If you've seen any of my other videos talking about wisdom teeth, I always talk about, if you can keep it clean, you can keep it. So it doesn't matter how old you are. If you have wisdom teeth that are not able to be kept clean, you should get rid of them, because over time, not only does it increase your risk for periodontal disease, gum disease, but it also increases your risk for cavities, which increases your risk for an emergency. So get rid of those wisdom teeth, because you should be able to eat and drink with joy and not have a wisdom tooth bothering you all the time. If you're too scared to do all of them at the same time, which I highly encourage, I would highly encourage you at least get the one that's bothering you out as soon as possible. So that's it for this video. I hope that me answering these questions, maybe you learned something about your situation. I am always willing to answer questions. So if you have any further questions or comments, please feel free to leave them below, and I respond to as many comments as I can. And you can definitely email me at modernsmilecs@gmail.com with any x-rays or photographs or just opinions in general, so I can help you get a second opinion digitally. If you enjoyed this video, make sure to give me a thumbs up and subscribe to the channel. Thank you for watching.